All right, I know what you're thinking. You're thinking, wow, you really went long on that first lecture on normal respiratory function. So I will endeavor to break it up into smaller chunks and not go too long. So I'm going to try to talk about manifestations of respiratory disease, which tend to be common across a lot of different respiratory diseases, and then cut that off, and then in the next section talk about respiratory infections. It'll all be in this PowerPoint though. So in the learning objectives, I have all the learning objectives for the rest of the chapter. So for this part, describe common upper respiratory tract infections, just explain how secondary bacterial infections occur in the respiratory tract. And we did talk about this a little bit in last quarter in the infectious disease chapter. Compare the different types of pneumonia and the possible outcomes of aspiration. And then the second half of the learning objectives will be in upcoming lectures. So the general manifestations of respiratory disease, any respiratory disease, sneezing, we're all familiar with that, right? It's a reflex response to irritation in the upper respiratory tract, and it assists in flinging the irritant from your nostrils or throat, removing it from your system. But it can also be associated with inflammation, so you can't sneeze inflammation out, but foreign material and inflammation. Coughing can be caused by irritation caused by nasal discharge dropping back into your throat. Some people call it postnasal drip. It can be caused by inflammation or foreign material in the lower respiratory tract. So you're trying to cough up something that you got aspirated. It can be caused by inhaled irritants. There is a cough reflex that is controlled by a center in the medulla, and it coordinates the actions of inspiration of air and then closing the glottis, followed by forceful expiration and opening the glottis to try to get something out of the lower respiratory system. So there's a lot of coordination that has to go on, and the medulla handles that coordination. So a constant dry or unproductive cough is annoying and fatiguing because it interferes with sleep. And if you're on a plane from Seattle to Buffalo and somebody else is coughing the whole time, it interferes with other people's sleep too. Not that that's ever happened to me. There's no good flight from Seattle to Buffalo. I'm just going to tell you that. Unless they've changed it since I recorded this. I don't think they have. If you're having a problem with excessive cough, you could also get your respiratory muscles get sore, your abdominals get sore. I'm sure you've all experienced that when you've had a cold or something. There's fatigue associated with coughing. And so a lot of times they'll recommend cough suppressant medications at night. Sometimes sleeping on an elevated surface helps relieve that a little bit because you get rid of the postnasal drip. Productive cough is usually when you have secretions or inflammation or inflammatory exudate that accumulates in the lungs. And removing those fluids from the airway is beneficial. So when people are coughing up stuff in the hospital, I congratulate them, like, yay, cough that stuff up, get it out of your lungs. So sometimes we want to encourage a cough, sometimes we want to discourage a cough. But if they're coughing up secretions, then yes, we want that stuff out of their lungs. So a lot of times it's important when someone's in the hospital to keep to increase their fluid intake. That's like one of the basic things that, your mom or somebody tells you when you're sick is drink a lot of fluids. And the reason we want to do that is because we want to keep our secretions thin and easy to remove. If they aren't, a lot of times you'll take an expectorant, which thins your secretions and makes them easier to cough up. So an expectorant, usually they're over the counter that they get, they give them to you. If you're taking an expectorant, it's not going to stop you from coughing. It's just going to thin your secretion so you can cough that stuff up. You really want to cough that stuff up. Humidifier is also helpful for removing secretions. Thick or sticky mucus is really difficult to get from the lungs, especially in weakened people, so elderly or debilitated, or people with spinal cord injuries, so they have inadequate intercostal support and expiratory support. And so sometimes you need to do assisted breathing techniques with them, which we will learn in lab. So coughing, like it can be a bad thing or it can be a good thing. If you've got stuff in your lungs, you need to cough it up. So there you go. And there are some techniques that we can use to help people cough it up. Okay, so here's what gets coughed up. Comes a time when you have to talk about sputum, and this is it. And like nurses are always interested in people's bodily secretions and what color they are and what, because they can be diagnostic or indicative of certain conditions. So if your sputum, the stuff you cough up out of your lungs, is yellowish green, cloudy, or thick, it's often indicative of a bacterial infection. In fact, if anything in your body is yellowish green, and then it's often indicative of a bacterial infection. If you see a wound that has greenish, yellowish green stuff on it, bacterial infection. So that's a little nature's signpost that you got to read. And then get that sputum and get a culture and sensitivity done on it so we know what it is and we can kill it. Rusty or dark colored sputum is usually a sign of pneumococcal pneumonia. And it's like rusty kind of indicates blood sometimes. So you're coughing up blood, that's not a good thing. Hemoptysis is where you're actually coughing up bright red blood-tinged frothy sputum. And so that's indicative of pulmonary edema. But rusty dark colored sputum, it's gunk from your lungs that is that you probably have pneumococcal pneumonia. Very large amounts of purulent sputum with a foul odor, yucko, right? May be associated with bronchiectasis. So you have pus in your bronchioles. That's not good. Pus is a byproduct of bacterial infection, and you're not supposed to have bacteria in your bronchioles. So that's a problem. So thick, tenacious mucus can be caused by asthma or cystic fibrosis. You could get blood-tinged sputum from a chronic cough, or it could be a sign of tumor or tuberculosis. So thick, tenacious mucus, and that's often one of the problems with asthma and cystic fibrosis is you can't cough it up because it's too thick and clingy. And then hemoptysis, just talked about, blood-tinged, bright red, frothy sputum, usually associated with pulmonary edema because that bright red, it's that freshly oxygenated blood that goes right into your sputum. So yikes, right? Never good stuff. It's the in the book they talk about, and we'll talk about this when we talk about vomit. I'm sorry, it has to happen. We don't want to confuse hemoptysis with hematemesis, which is vomiting blood. And usually the vomit containing blood, they call it coffee ground emesis. It's usually granular and dark in color, like wet coffee grounds, because the blood has sort of been partially digested in the stomach. So if it's bright red blood tinge, that's hemoptysis. If it's coffee ground looking, that is hematemesis. So you're coughing up blood is different from vomiting up blood. So, I know this is the kind of class this is when we talk about these things, but it must be talked about so we know what we're talking about. Breathing sounds can be normal, like we talked about eupnea and whatnot, and they can be abnormal. So the normal rate of eupnea, and you'll see different values depending on where you look. Some of them say 16 to 20. In this chapter of the text, it says 10 to 18 inspirations per minute. So that's our normal rate. So any changes in the rate, rhythm, or depth are significant. So you need to evaluate that. So then they have names for them all just to make it interesting. So we talked about the Kussmaul respirations, the very deep Sometimes they call it air hunger, and it's typical of a state of acidosis or following strenuous exercise. And so if you're doing anaerobic, like you're exercising so strenuously that you're in the anaerobic stage, you could put yourself into acidosis because you're no longer doing aerobic metabolism, you're doing anaerobic metabolism, and the byproduct of that is lactic acid, which gets in your blood and increases acid level, and then you're in acidosis. So Kussmaul breathing, air hunger. Labored respirations or prolonged expiration times are often associated with an obstruction in the airway, and we talked about that in the last section. So wheezing is I have another thing with wheezing. Oh, maybe I didn't get wheezing on the slide. Anyway, wheezing's in the book. It's not on the slide. But wheezing or whistling sounds indicate obstructions in the airway. So a lot of times with asthma, you get wheezing, and the obstruction in the airway is that thick, tenacious mucus that you can't get rid of. Horrible stuff there. Stridor, which we talked about in the last section, is high-pitched crowing noise, and it usually indicates an upper airway obstruction. So the breath sounds may be abnormal or absent in respiratory disorders. Rales and rhonchi are abnormal sounds, and it has to do with excessive secretions in the lungs. So rales are a light, bubbly, crackling sound, and that is serous secretions. Rhonchi are sort of deeper, thicker, harsher sounds, and that's from thicker mucus. So with like cystic fibrosis, you're going to get rhonchi. The absence of breath sounds means something's wrong. You're not getting aeration of your lungs, or your lungs are collapsed. That's never a good thing. So absence of breath sounds indicates non-aeration, or it might be atelectasis, which is the collapse of the alveoli. So dyspnea, it's a subjective feeling of discomfort, and it may be caused by increased carbon dioxide or hypoxemia. It's often noted on exertions such as climbing stairs. So we talked about, when we talked about heart failure, people that have dyspnea, it can be severe. So someone who has heart failure and their heart is not supplying them with the oxygen that they need, they can be very, very out of breath just on like minimal exertion. It's something that someone who doesn't have heart failure would consider to be minimal exertion. So dyspnea is not just with respiratory disorders, it's with other things as well. Severe dyspnea can be indicative of respiratory distress. So if the nostrils are flaring, use of accessory respiratory muscles, lifting the shoulders, restriction of muscles between or above the, or retraction of muscles between or above the ribs. So like you'll see people's sternocleidomastoid really working, that can be indicative of respiratory distress. Orthopnea is discomfort with breathing with lying down, and it's caused by pulmonary congestion. So if people have left-sided heart failure, the backward effect is pulmonary congestion. They have difficulty breathing when they're lying down, and the answer is sit up. So the answer is don't lie all the way down. Well, and treat the primary problem, of course. But if you're having trouble breathing when you're lying down, then sit up. That's or tilt the bed up. Respiratory symptoms, and we talked about this with heart failure as well, the paroxysmal nocturnal dyspnea. It's sudden acute dyspnea during sleep. So when you're sleeping, your body fluid is sort of sloshing around. It's not following kind of its normal function. And that can lead to pulmonary edema, and the person like wakes up gasping for air and coughing. So it's common in people with left-sided congestive heart failure because of the pulmonary edema. Cyanosis is the bluish coloring of skin and mucous membranes. It's caused by large amounts of unoxygenated hemoglobin in the blood. So oxygenated hemoglobin is pink or red, and unoxygenated hemoglobin is bluish. If you have a dark-skinned individual, You can detect cyanosis inside the lips, inside the eye sockets, in the nail beds and the bottoms of the feet, and sometimes the palms of the hands. So that's important to know that if so you have a dark-skinned individual, you still need to be able to detect this. Pleural pain is a common respiratory symptom, and it results from inflammation or infection of the parietal pleura. That's like the inside of the thoracic cavity that the lungs have to move against. Friction rub, it's a soft sound with rough inflamed pleura moving against each other. Oh, that just sounds awful, doesn't it? Club digits result from chronic hypoxia associated with respiratory or cardiovascular diseases. So we talked about this with sickle cell anemia. Sometimes you get clubbed digits. It's painless, firm, fibrotic enlargement at the end of the digit. There's a photograph of it here. Changes in arterial blood gases can be signs of respiratory distress. Hypoxemia, so inadequate oxygen in the blood, or hypercapnia, increased carbon dioxide in the blood. So those are two like big signs of you're not getting gas exchange. The carbon dioxide is not going out and the oxygen's not coming in. Okay, next section we'll talk about upper respiratory infections. See, I held my promise there. Didn't go too long.